Grace, thanks. Well, 2020 is proving to be the year of stress as many people, especially students, adapt to the many new circumstances due to COVID-19. Here to talk with us about some helpful tips for managing that stress is Dr. Casey Berson. Dr. Berson is a child and adolescent psychiatrist with Prisma Health Upstate. Doctor, thanks for joining us this morning.
Thank you for having me.
Oh, it's an absolute pleasure. Now, we know that things do look a little different with 2020 and school being right around the corner. What are the general guidelines to keep in mind for going back to school?
Absolutely. And I think the problem is there's so much unknown, and adaptability is really key. So when we look at COVID specifically, a preponderance, which is a big word, just means a lot of the evidence will indicate that children and adolescents are less likely to have severe disease, and there's low rates of transmission when community rates are low and we follow appropriate guidelines. That being said, right, again, it's this balance because we know how important schools are, and the AAP, the American Academy of Pediatrics, really recommends trying to work toward in-person because of how much benefit we get from there. So we're trying to figure out what makes sense, and things change all the time, and so it's really being a little bit fluid there. Those aspects, yeah.
So we do know that there is a lot of concern for parents as they mention in-person instruction and going back to classes, and of course keeping a close eye on the numbers. You did mention the importance of in-person instruction. Why is it so important for kids?
Yeah. Sure. So schools right now do a lot more than just education. So there's a big part, right, of social development that happens when we're in schools. They provide for some students occupational therapy, speech therapy, meals in some cases as well. What we actually find, though, too, is in-person instruction disproportionately, lack of in-person instruction will disproportionately harm low-income and minority children who would benefit from a lot of those resources as well. And so I think that it's a real question, and how do we make this work, and how can we make it happen, because it's important to go there. Likewise, right, with all those services, heightened behavioral needs, disabilities, developmental delays, to do that outside or in a virtual setting just becomes a lot more complicated and difficult.
Yeah, and I know the stress being felt with the parents as well as the kids, and for the kids getting ready to go back to school. How can parents and caregivers help in this process?
That's a great question. So there are a couple things that we can be aware of and can do. So the first is to know where you're getting your information from and where the kids are getting their information from too. So we want to make sure that what they're looking at are from sources like the CDC, the American Academy of Pediatrics, the American Academy of Child and Adolescent Psychiatry. What we find with information that gets shared is something that causes an emotional response is more likely to be shared, whether that's true or helpful. So it's important to know what they're listening to pay attention to that, and to recognize ourselves how that affects us. So as caregivers, as parents, knowing what is important too. So kids are a lot smarter than we give them credit for. So if we're anxious, they'll pick up on that. So maybe after dropping them off at school is when you call your own support person as well. Being there for your kids, because I'm sure they're going to have questions, just to listen can be really helpful. Being reassuring and calm if you can. And then teaching them ways, that are things that they can do to help spread the disease themselves. So staying home if we're sick, learning to wear our masks for longer periods of time. Now, if they're under 2 years old, that's not recommended. It's still hard. And, hand washing techniques and what makes sense. So yeah. I think all of those are important.
Absolutely, and I know a lot goes into it. And Dr. Berson, before we let you go, really quick, one
Sure.
last question. With all the anxiety that the parents and the students might be feeling, we hope to never get to that point, but when should we seek further help?
Thank you for asking that. So kids and adults don't always show those things the same way. So look for things like excessive worry or sadness, changing to the eating or sleeping habits, changing to focus or concentration, low energy for parents as well as children, irritability. All of those things can be indicators that we should reach out for further help.
Absolutely. Dr. Berson, child adolescent psychiatrist with Prisma Health Upstate, thank you so much for the information this morning.